Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Dr. Annie Bailey, one of our amazing family medicine physicians. Today, we're diving into an important conversation about diabetes and prediabetes, conditions that affect millions but are often preventable or manageable with the right tools. This is the perfect time as November is Diabetes Awareness Month. So, we're going to explore how lifestyle medicine, including nutrition, movement, stress management, and more, can play a powerful role in preventing, controlling, or even reversing these conditions. So, whether you're living with diabetes, at risk, or just looking to live a healthier life, you're in the right place. Let's take the first step toward better health together. Starting by giving us a like. Let us know you're watching. Share this broadcast with your friends and family. And if you have any questions, feel free to ask them in the comments. Welcome, Dr. Bailey. Thank you so much for joining us.
Good afternoon. Good to see you. I'm Dr. Bailey. I am triple board certified in family medicine, lifestyle medicine, and obesity medicine, and happily serving in the district in the Navy Yard community. So, really excited to talk more about lifestyle medicine today.
Likewise, thank you so much. Well, let's start with the basics. What is lifestyle medicine?
Yeah, so lifestyle medicine, in my opinion, is what all patients want. So it's evidence-based steps to address the root causes of a lot of the chronic conditions that we're seeing. So blood sugar, blood pressure, cholesterol, etc. And what it does is it really incorporates sustainable changes that people can make that make a big measurable difference in terms of their health outcomes. With that, lifestyle medicine has six pillars. So, healthy eating, physical activity, stress management, social connection, how you're sleeping, as well as avoiding alcohol and tobacco. So, I really like to say it's really all about how we eat, how we move, how we manage our stress, how we're sleeping, and then what substances we're avoiding, and how we work on connecting with our community, be it our friends, family, volunteering, or otherwise.
I love that. It sounds like it's really the whole person. Um, why is lifestyle medicine gaining so much momentum in healthcare?
Yeah, so like I said, it's evidence-based, and I really think the two biggest things is that people really want to work on these things, and it works, right? So when we talk about risk reduction with lifestyle medicine, we see almost 80% risk reduction in terms of chronic conditions. That goes up to over 90% for diabetes in particular. And then similarly, risk reduction for things like a heart attack goes up over 80% as well. So that kind of makes a really big difference in terms of how people are able to live longer and live well.
Hmm, makes sense. Thank you. So we talked about lifestyle medicine helping to prevent or even reverse chronic diseases. What are some things that people can do to address those chronic diseases?
Yeah, so, I work with the MedStar Healthy Living program, and one of the things that we really utilize are SMART goals, which a lot of people in different industries use for different reasons, right? So it really works on following an action-oriented goal system to set specific, measurable, but achievable and realistic goals that you can do in a timely fashion. And so this is a program that's open to any MedStar primary care patient. You connect with a physician, a health coach, and more importantly, with your peers to talk about different topics. And it really is a good way to have a little bit of choose your own adventure, right? You choose your why, you choose your goals, and you tell us what's sustainable and achievable for you. And we work with you in terms of achieving those things.
I love that. That sounds like a great program. Um, and you mentioned who it was available to, so it would be available to someone who has been diagnosed with diabetes or pre-diabetes who's a MedStar patient?
Right, absolutely. So, any MedStar primary care patients are eligible. Just ask your primary care doctor for a referral. And really, anyone who has any evidence of insulin resistance. So, insulin resistance really just speaks to our body starting to have a difficult time with how they manage the carbs and sugars that we're eating, right? So, that could be diabetes and prediabetes, but it might also be that you have a family history of blood sugar problems and you're worried about that in the future, or maybe even PCOS, which can be thought to be along that insulin resistance pathway.
Okay. That's really great. What are the benefits of participating in the program?
Yeah, so when we think about it overall, like it's really creating a new lifestyle change for you, right? So it helps across the board with multiple chronic conditions. The programs can be targeted. So, like for the diabetes, pre-diabetes pathway, we really are focusing on blood sugar control. But we anticipate that we're going to see assistance with other things as well, particularly when we think about cardiovascular, kidney, metabolic health, right? So we might see improvements with your blood pressure, we might see improvements with your cholesterol levels, and even with weight management, right? We think about diabetes and prediabetes as being a blood sugar problem, but really they go on to cause all these other issues down the way that we would really like to prevent, right? So people really get motivated towards, I'd really like to not have heart disease. I don't want to worry about strokes and heart attacks in my future. I've heard of people having kidney disease and going on to need dialysis. I would like to, really avoid that. But then also things that may seem a little bit more subtle, right? So like vision changes, hearing changes, memory changes, right? Things even like GI related symptoms, changes in your digestive tract, your neurologic symptoms. So a lot of people have like neuropathic pain, which could be a really big issue. So you really want to get ahead of those things.
Hmm.
Mhm.
Okay. That's great. Um, this program has been around for some time. When did the program become available?
Yeah, so we launched earlier in the year. There's multiple physicians participating in the program, so you may even see one of your own PCPs. And the patients are loving it. Like it's really something that is allowing for a collaborative approach, and allowing people to learn from one another. So I think that um, installing and starting these programs as focusing on blood sugar, prediabetes and diabetes, or focusing on blood pressure, and then taking it from there and building on patients' experiences.
That's great. So what are participants saying about the program?
Yeah, the feedback's been overwhelmingly positive, which is great.
Good.
So a lot of people like to like share what's been working for them. So I talked earlier about how we're working on setting these specific SMART goals. And then as we're revisiting each session, people might chime in and say, I tried this in terms of movement, and I found that, if I got a friend to do it with me, that was really helpful. Or, I set a goal about how I wanted to change what I'm eating, and here's a recipe that I really love. So it really helps patients to learn from each other, which is a really good learning tool. And then also sharing successes, right? I started this, my blood pressures were high, and now they're better. My blood sugars were high, and now I'm seeing these improvements. And my doctor is even surprised by my cholesterol numbers. Like those are the types of things we're trying to hear.
I love that. Yeah, it sounds like the collaboration, being part of a group and being able to work through challenges together and even celebrating the successes, I'm sure has been extremely beneficial to those that are in it. And yeah, I love
Absolutely.
hearing about recipes and tips. I think that is something that we all share, right? You find a good recipe, or you're always looking for a good recipe, maybe something quick or something new that you haven't tried before. And yeah, having people that you can bounce ideas off of, I'm sure has been really a nice addition to the program outside of the wonderful things that you're getting from your clinical partners. Um,
Absolutely. I
yeah.
think one of the most powerful thing that I've seen is people sharing kind of like region specific tips and tricks. So like either certain companies that they can work with or certain workout classes that they enjoy, and even choosing to partner with each
So,
other on some of those things. It's been really motivating.
oh, I love that. Go for a walk together. Yeah. It's
Exactly.
always it can definitely be motivating to have someone who you can exercise with, even just yeah, one of those things that I know all of us should be doing. And but it can be hard, especially when you're trying to, motivate yourself. But having friends and family who can help you, I think,
Right,
just
which
feel more successful.
it's nice because it leans into a little bit of that lifestyle medicine pillar of like social connectedness and really like doing things with each other, but then also to the accountability side of it, right? Like everyone has days where they would rather just not do X, Y, or Z, right?
Yeah.
But it's really nice to either have either your family members or your friends or even people that you just met at the gym saying, hey, we said we're going to meet at 5. Are you still coming? That type of thing.
Yeah, holding each other accountable.
Yeah.
Absolutely. Yeah, you mentioned the community piece of it. Can you tell me a little bit more about that? How do we encourage or help participants outside of some of the other things you mentioned with exercise and diet, encouraging them to get out into the community or doing things that they love to help their mental health?
Yeah, absolutely. So, it really is kind of a whole body approach, right? And so, like we live in the DMV area. This has been a stressful year for this area, I would say. And so, like, really incorporating some mindfulness and movement techniques in terms of stress management and talking through how that's helpful in terms of affecting chronic conditions as well has been really good. So, like through the sessions, we'll kind of do an example of what it looks like to do a guided meditation with everyone. And that's something that you can do pretty much anywhere. It's free. Everyone loves free. And it doesn't take up a whole lot of time. But then also giving options for things that might be a better fit. Like some people really like to combine movement and mindfulness. And so maybe yoga is a really good fit for you. Maybe you're a person who likes to really write out their thoughts. And so journaling and in particular gratitude journaling might be a good thing that you might want to consider.
Yes, I love all of those things. Thank you very much. So we talked a lot about lifestyle medicine helping, especially those with diabetes or pre-diabetes, and this program certainly would be beneficial. What other advice would you give someone who's been diagnosed with those chronic conditions?
Yeah, and I work in primary care, so I get this question all the time, particularly for people who have either a new diagnosis or a concern about a future diagnosis. And I really like to encourage people to focus on what you can control, right? So, with a lot of chronic conditions, we know it's epigenetics. Some of it is your behaviors and how you're living, and some of it's just the genes and the family history that you have, right? So, there's not as much that you could do about these non-modifiable factors. We're all going to get older. The risk will get higher as we get older. That's just a life thing. But there's a lot of things that you really can do. And particularly for, thinking about diabetes month, right? So we know that lifestyle modifications are helpful in terms of lowering people's blood sugars. And a lot of people get worried that because they have a family history of diabetes that it won't work for them. But we've actually studied that and found that healthy eating tends to lower without the genetic predisposition that you may have. So without regard to that, we see across the board that eating healthily and moving your body can make a really big difference. So for people who have diabetes and prediabetes, I really just like to encourage them on making changes that are going to be gradual and sustainable and something that you can keep up with. Because if you go 0 to 100, you may get there fast, but you may not stay there, right? Um, and one way that I like to do this, I encourage people to, have more fiber forward eating, right? So power up all of your meals with more fiber. That's your fruits, your veggies, your legumes, like your beans, eating more whole grains. And that really helps to kind of stabilize things in terms of your blood sugars, less spiking in your blood sugars, which is something with people with diabetes and prediabetes worry about.
Mhm.
And then for movement, I would say, movement is great. All movement across the board. Exercise we think of as being an insulin sensitizer. So if you have an issue with insulin resistance, this really helps your body in terms of how it's able to process its blood sugars, right? So pick something that you would do anyways, right? Pick something that you enjoy. Maybe it's dancing, maybe it's getting outside and walking. And I ask all of my patients, like, what movement-based things do you enjoy? And every so often someone says, I don't enjoy any movement. I don't like it. And that's a fair answer, right? And in those cases, I really encourage people to tie it to an activity you enjoy. So maybe you don't like exercising, but you like TV or you like reading. So you could put on an audiobook and go for a walk. You can put on your favorite show and do some squats. So it's really picking something that fits your lifestyle, right? And research has showed us that this is something that is supported. So we think of for movement goals like 150 to 300 minutes a week would be a reasonable goal for how much movement you could do within a week. And some people will say that sounds like a lot, but you could break it into 5, 10, 15-minute intervals if you need to and just do a little bit every day, right? And in terms of like what types of activities you're doing, like I always say, until we achieve like Beyonce status, if you can talk but not sing, you're probably doing moderate intensity level of workout. And so that's good. But if you're doing something even more intense where you can't talk, you probably moved into vigorous intensity activity and you could probably cut back on the time if needed. Okay. So if you're looking to do something quicker, then maybe you do something a little bit more intense. And across the board, and I would say this applies to multiple chronic conditions, sleep is a major factor, right? So, like sleep hygiene is just something that they probably should teach in schools, but we don't. And so, really working on optimizing your sleep. And if you're not able to do that independently, then working with your clinical team and talking to your primary team about resources for that, both sleep and stress management. If you run into an issue with that, ask for help, right? So, it's not something that happens overnight. Not everyone's able to develop their own stress management routine. And stress is unfair in that you don't have any control over external stressors. They just show up, right? And so it's really just how you manage how you react to them when they do show up is what you can do. So if needed, MedStar also has a really good behavioral health team. So we have a lot of different resources we could play around with, right?
Yeah.
And then we talked earlier about, looping in other people. Like I think that lifestyle change is the most sustainable when your household's on board, when your friend group's on board, when, if you're trying to work on cooking all of your meals using whole foods and your friends are asking you, like, I'm stopping here. Do you want me to grab you something? So it's helpful to talk to people about what you're doing and then also loop them in because maybe they want to do something similar, right? So meet people where they're at with that. And then I'm a millennial, and so I'm kind of like in between in terms of technology, but I just love all the stuff we have, right? Like YouTube's our friend. We have, AI is a resource. You can let them know, like, this is what I'm trying to achieve. This is my goal. Can you help me build a plan? Can you help me find a recipe? And really utilizing all those things that we have available to us.
That is some great advice. And yeah, I know
Hmm.
we focused a lot on diabetes because it's Diabetes Awareness Month, but
Hmm.
you mentioned the other chronic conditions that this would help. And really, even if you don't have a chronic condition, it sounds like, all of these things are important to keep our bodies healthy and our minds in a good place. And I love your tip about exercising, even if you're not a big exerciser, a big mover, you like to watch television, stand up and watch the television while doing some squats. Maybe just, I feel like you can incorporate exercise or movement really in anything, even if it's just grocery shopping, right? You know, walk around the aisles, do some lifts with use the, cans as weights. I've heard that before, stuff like that. And then, yeah, of course, encouraging each other and sharing your ideas. I think you people thrive off of others' energy. So if you are doing these things and you have some success stories or you're just feeling really good about it and you're rallying your circle around it, someone else could be encouraged to do that, right? So being an advocate for yourself and encourage others, I think, is another important aspect of this. Yeah, I think going back to other types of chronic conditions, um, thinking about, yeah, hypertension and even weight loss could also, um, be another opportunity to incorporate lifestyle medicine into your daily routines. And then, of course, yeah, the healthy living program. So the healthy living program, do you need a chronic, would you have, I know it's for MedStar Health patients. is it for those that are have been diagnosed with a chronic condition, or could, if you're just trying to be preventative, could you have a conversation about some of the things that are going on in that program as well?
Yeah, so the MedStar Healthy Living program, it's really been blossoming this year, and I've loved to see this happen. And so there's a lot of different things we could talk about. Like we did focus a lot about blood sugar today since it's Diabetes Awareness Month.
Mhm.
But a lot of people have concerns about their blood pressure. And I would say one of the most frequent things I'm hearing now is brain health, right? People are worried about memory changes as they get older. And weight management. A lot of people, I don't think anybody has not heard at this point about Wegovy and Zepbound and all of these medications. And as people are taking these things and losing weight, we have tracks for all of this. So we have a track that focuses on your blood pressure, a track that focuses on optimizing your brain health. And then for people who are interested in weight management, and particularly if they're taking medications, how to lose weight while also maintaining a healthy lifestyle alongside of that. So how do you do it in a way that really ends up being a long-term sustainable plan and something that leaves you in a positive place at the end of it, right?
Mhm.
So those are things that you could talk to your MedStar primary care doctor about. Do I have any of these conditions? Or maybe I have these concerns or this family history. Would I be a good fit for this program and get recommended to join?
Yeah, sounds good. So yeah,
Mhm.
it sounds like if you have a MedStar Health primary care provider, have that conversation. If you do not, and this is something that interests you, that's the first step, is to make that appointment. Dr. Bailey, anything else you want to share about lifestyle medicine, or what is a good key takeaway that you'd like to share with our viewers before we wrap up?
Yeah, I mean, I would overall say that as we think about lifestyle medicine and MedStar's healthy living program, like the goal is, yes, to live long, but also just to live well and to feel well while you're living and do the things that you enjoy doing, right? So, like, the living part of life, that's going to keep going no matter what. Like, I don't know about you. I just feel like between saying Happy New Year and saying Happy Halloween, like maybe 1, 2 weeks backs went by. I just, it just really flies by very quickly. So you want to like use your time in a meaningful way and make changes that really allow you to maximize how you're feeling and how you're living. And that can easily be done with the pillars of lifestyle medicine.
I love that. That is some great advice. Well, thank you so much. That's all the questions I have for today. This was really helpful information, and I love that we're sharing this benefit with our community and how they can participate and also benefit from this. Dr. Bailey, thank you so much again, and thank you to our viewers for watching. We'll post a link in the comments for you to learn more. Until then, we'll see you next time.
Thank you and be well.